All right, so now let's talk about the fetal development of the cardiovascular system. So there are some differences, which is hopefully something you knew, even if you don't know exactly what those differences are, between a fetal cardiovascular system and even a newborn's. Although the newborn's is a little bit more similar to the fetal, but things rapidly change. So one of the things is the fact that the a lot of the functions of like the liver and such are actually taken up by the placenta. We are still going to have an inferior vena cava. We're still going to have a pulmonary artery. However, we're going to have a lot of bypasses because there are a lot of systems that are not online in a fetus. We are going to bypass those unused, unnecessary tracks. So there is a lot that's going to occur here in regards to bypasses. So for instance, here, we're going to have what's called the foramen ovale. And the foramen ovale is actually going to be essentially a bypass between the right and left artery, or atria, because we don't need to have blood circulating to the lungs. The lungs are not online. The lungs do not become online. And in fact, they're one of the last things to be developed until you're born. They are developed in that last month and a half. That's why if you're born too early, you're at risk for even a respirator or ventilator not working because you don't have any lung tissue for that ventilator, for that respirator to work on. So it is something that we do need to be aware of. Now, a couple other bypasses. We have the bypass at the liver, ductus venosus. Foramen ovale is the bypass in the atria. There is a ductus arteriosus, which is a bypass from the pulmonary artery to the aorta, because again, we don't need blood circulating to the lungs. So even if we do have blood going into the right ventricle, it still needs to come out. And so we'll have a bypass here. These bypasses should close shortly before / shortly after birth. Obviously, we have the umbilical cord as a bypass. Now, if they don't, we're going to have some issues, which we'll talk about in a minute. So these are fetal heart structures that bypass the pulmonary circulation. As I mentioned, the foramen ovale connects the two atria, and the ductus arteriosus connects the pulmonary trunk and the aorta. All right, here we go. Congenital heart defects. So a ventricular septal defect is when the superior part, so the top of the septum is the divide between the right and left ventricles of the heart, when that fails to completely form. So blood freely mixes between the right and left ventricles. This is a problem because the left ventricle is stronger than the right, so blood is going to get pushed into the right more than into the left. More blood's going to go into the right side of the heart than is going to go into the aorta. And we're going to have oxygenated and deoxygenated blood mixing at a ratio that's going to cause problems for getting oxygen to the body. Because remember, the goal is to get oxygen to the cells so they can use it. This is about a 1 in 500 occurrence, 1 in 500 births. So, coarctation of the aorta is when the aorta is naturally too narrow. So instead of being nice and wide open, it's too narrow. This is going to increase the resistance and therefore increase the amount of effort the heart has to do to get blood to go through there so it can get to the rest of the body. This is again about a 1 in 1500. Then there's something known as tetralogy of Fallot. Tetralogy, you could know logy is study of, tetra is 4. So study of 4. This is actually 4 birth defects, at least. So what are these 4 defects? The pulmonary trunk is also narrowed. The pulmonary valve is stenosed, meaning we're going to have a hard time opening and closing it. This is going to cause hypertrophy or excessive musculature of the right ventricle because it's going to have to work harder to get blood into the pulmonary circuit. The aorta is actually going to open from both ventricles. That ductus arteriosus, this right here, did not close. That is still open. So we're going to get blood going into the aorta from both ventricles, and the right ventricle is going to be over thickened. A couple of other things that typically fall under this category of birth defects, which is about 1 in every 2,000. Typically, we'll also see the foramen ovale has not closed. So we're going to get blood still circulating between the right and the left atria. Typically, we will also see things like the ductus venosus down here hasn't fully closed, and so we're going to get a bypassing of the liver. None of these are good. Thankfully, when detected, a lot of these bypasses not closing can be easily fixed with surgery. Now, these narrowings, however, are a little bit more difficult.